Welcome to Behavioral Health in the New Normal, a podcast developed by Prestige Community Resources, aimed at bringing healing back to our community through knowledge, expert advice, and positive messaging. The show is a joint venture between the Department of Behavioral Health and Prestige Community Resources, funded by SAMHSA in response to the challenges currently impacting our communities. Hosted by Paul Wells Sr., who uses over 30 years of extensive clinical social work experience to conduct insightful interviews with experts and professionals on a wide range of topics that impact the Washington, D.C. community. From behavioral health crisis to education to financial hardship and anything in between. This show will provide information and insights that will surely make a difference in your life.
I want to welcome our audience back to the Prestige series, podcast series, Our New Normal. And audience, man, I am so excited. We have a powerful woman who's going to give us some information of how the pandemic has increased virtual learning. And she's going to discuss with us the pros and cons, the differences between in-person and virtual learning. She's going to be sharing her opinion about how virtual learning has allowed our communities to have additional access to education, and while in-person learning is unavailable. So with no further ado, I want to introduce everyone to Dr. Loyce B. Pailen. Dr. Pailen, how are you? And welcome to our show.
Well, I'm fine. Thank you very much.
Yes, we're so excited to hear from our expert, her experience. Before we begin, though, I need to remind the audience that this podcast series is a joint venture between the Department of Behavioral Health and here in Washington, D.C., Prestige Community Resources, and SAMHSA. And so we're delighted regarding the investment that has been made to get the information out to the community. But Dr. Pailen, I would like you to introduce yourself. And we normally begin by asking you to share a little bit about yourself personally and maybe a little bit about yourself professionally. So why don't we start from where were you born and how were you raised and what school did you go to? And
Sure, not a problem. I actually was born and raised in Brooklyn, New York. Far from there now. I moved out of New York when I was in my early 20s, which has been quite a while ago. So I'm not even sure if I still identify with being a Brooklynite. I don't have the accent anymore, yes. But I've been in the Washington, D.C. area for many, many years. And most of my academic and work life has been here in the Washington DMV.
I understand your focus has been professionally on education. Can you tell us a little bit about that?
Sure. But right now I'm in the education arena in higher education. I am the senior director for the Center for Security Studies at University of Maryland Global Campus. We used to be UMUC. We're now UMGC. And my responsibilities are mainly for supporting the university's activities that relate to it being a center for academic excellence in cybersecurity. So while I'm doing that now, a lot of my career at UMGC was in the environment of teaching and curriculum development. So over the last 10, 15 years, I was involved in creating our cybersecurity master's degree program. And like now, I'm much more concerned about using our leverage as a university to garner and to apply for scholarships that are available for students who are interested in cybersecurity academics and cybersecurity careers. But as a little bit of background, I got into cybersecurity because of my technical background. So before I came to the university, I worked in the media industry. I was a longtime employee at the Washington Post Company. Way back when it was data processing and we were doing punch card programming and things like that. That goes way back. But where I got all of my technical background in software development, project management, networking, and network support, and some of the other technical areas. So I've had a wide range of experiences here in the Washington area, working in information systems, which morphed into cybersecurity. And as I retired from the Washington Post, I got into education, and that's how I wound up at UMGC. And like I said, for the most part, I taught undergraduate and graduate cybersecurity and technology courses. But now for the last 3 or so years, the focus has been on supporting our student body and getting involved actually with the K-12 community because of the workforce needs of cybersecurity. They're very great, and we want to make an impact.
Yes, Dr. Pailen, can you define for us or describe to us what is cybersecurity? Is that?
That's a good question, and it really does depend on who you ask. I was called today, and just about every day, we're answering questions about whether is cybersecurity a technical career or is it a non-technical career? Could it be used in different disciplines? But I think what cybersecurity has morphed into is making sure that our systems and our people are secure when we're online. That's the nutshell. That's a very large umbrella under which a lot of different things fall, like networking on the technical side. It's making sure that networks are secure, making sure that people are protecting their passwords and their data and their privacy. So there's a whole list of things on the technical side, making sure that there are reducing vulnerabilities in your systems so that hackers can't get in. So on the technical side, cybersecurity is there's a lot, and there's a lot of careers that are involved. But on the non-technical side also, there are management and policy and cybersecurity awareness things that need to be done that are not so technical. You have to be able to take into consideration the human factors of cybersecurity, making sure that you, the user, are not causing viruses, introducing viruses into systems. There's just another side of cybersecurity that's not so technical, that once again, there are lots of career opportunities in that arena also. So to answer your question, it's such a big topic that it really does cover quite a few disciplines, subjects, and technical and non-technical things.
Yeah, thanks for sharing. About a year ago when the pandemic was announced, and of course, behavioral health clinics had to make some critical decisions around how we're going to provide service. And most agencies, clinics went to a telehealth format. Are there some concerns, or should clinics be interested in cybersecurity and what that means as they provide telemedicine? Is there some relationship there?
Sure, most definitely. There has always been a major concern about cybersecurity in the healthcare industry. And it goes from, privacy issues with your medical health records and someone hacking into that for various reasons, to worrying about, infusion systems in hospitals, whether someone can hack into the equipment that's used in hospitals in a nefarious way. So healthcare has always been an industry that has been impacted by cybersecurity, and definitely there are many concerns about. So you mentioned telehealth. So telehealth, the cybersecurity issues related to telehealth are the same ones that we're concerned about with teachers and students online. There are nefarious people out there who might want to do things when they can have access to your virtual environment.
Yes. I know the behavioral health clinics had to ensure that the Zoom accounts that they use were HIPAA compliant. So we're not using just the general layperson Zoom accounts. We have to have some heightened security there. And when you talk about privacy as well, we also have to be concerned where we're providing the service, the therapy, or the space. I mean, who has access to the space? And privacy is very, very important. What are your thoughts about virtual learning and how that relates to the pandemic? Many students now are learning remotely, and I've heard all kinds of reactions from students, pro and not so favorable around learning in that style. What are your thoughts?
Well, I have a lot of thoughts about it because on one hand, as I mentioned, I've taught online at University of Maryland Global Campus for years. We've been a virtual environment since I can remember. And I actually took some courses there too. I was a student there. So for a long time, many, many years, I've been in a virtual learning environment. And, you know, with that, we do very well. We have many, many things in place to make sure that students are getting the support that they need. We're making sure that faculty are engaged. It's always very important for the faculty to be engaged in a virtual environment. We don't want the students to think that they're taking a correspondence course. There's somebody there to lead them through the course. So from a UMGC standpoint, in a university that's been virtual for several years, I think we do a very good job with that. And I mentioned faculty engagement because I think that's the number one thing that gives the student, a virtual student, satisfaction with their course. They have a teacher there. They know that they can ask questions, that the faculty member responds in a reasonable amount of time. So that is just one of the number one factors of being successful in a virtual environment. On the other hand, I've also been involved in some K-12 activities. And my daughter, she teaches math online. So she gave me a lot of information. And since we're all together, I can see some of the issues that she faces in teaching high school students who are accustomed to being in a face-to-face environment. And so my opinion about that is, I think being thrust into that environment is a good thing. I'm a technology person, so I'm going to say I am happy that people are now being faced with what they thought they knew about technology and realize what they don't know now and how much there is for them to learn. I'm happy that people are getting that reason to be able to make some changes in the way they use technology. I think, we talk a lot about the digital divide, and I totally understand there are people who don't have the appropriate technologies, but I think it's also a push for people to obtain those things. There are lots of opportunities for students to get the technology and tools that they need to be in a virtual environment, and I think that is a good thing. Yes. But I totally understand, talking to my daughter in her class, these high school students are not quite as tech savvy as we thought they were. Things that she mentioned to me was that, some students, if you want them to cut and paste something from a document and put it into the learning management system, some of them are not even capable of doing that. So we're uncovering some of the things that we thought students had, but we're finding out that some of them is not as tech savvy as they should be. And let me give you an example. She in the higher education environment and in the K through 12, using video is something that's useful to students. In the higher ed arena, we use videos to reinforce learning. We use videos to meet with the students in a synchronous way. So video is used quite a bit. In the K through 12 arena, my daughter is trying to make her students understand that a video is almost as good as her being online right away in a face-to-face environment. But what they're having difficulty with is, of course, it's very difficult for them to sit down and listen to a 20-minute video, but they would listen to her talking to them personally for 20 minutes. There's a subtle difference in that they have problems sitting and listening to the video for 20 minutes. And it's hard to get across to them that a video, the technology is that you could listen to some of it, stop, take some notes, come back and listen to some more and take some notes. So it's just small things like that we're discovering that some of the students are not really thinking through the use of the technology in a virtual environment the way they could.
Yes. You know, I've had a lot of discussions with my peers, other therapists, facilitate intervention. Prior to the pandemic, it was primarily in person, you know, group therapy, individual therapy. And now most of us have gone to a telehealth format. And the therapists, my peers, have talked about the challenge they have professionally of performing a service in isolation, being alone, um, and not feeling a connectedness with the patients, with the consumers with whom we provide the service. I'm curious to know about the professors and trainers and teachers. What is their experience providing instruction remotely? Can you describe that for us?
Sure, and I once again with different perspectives from a higher ed standpoint, where a student registers for a course knowing that they're not going to physically meet the faculty. They may be in different states, they may even be in different countries.
Mm.
That expectation of just meeting the faculty member online, it kind of reduces some of the anxieties that a student may have. But if you look at, you know, in the K-12 arena, these children have met their teachers. They've been in the same room with them. They know them personally. So taking that away and moving to a virtual environment seems to be a difficult thing for many students to handle. I mean, you know, I think it's not only the personal aspect of it, but there's another level of interference, I would say. When the student is at home, they may have things going on in the home that the teacher doesn't even realize is going on. My daughter gave me an example of one of her students. You know, if they're on mute, you really can't hear a lot of what's going on. But if the child hits the unmute button, you can realize that there are parents and there are other children in the room, and the student has a lot going on that could be distracting to them. So, you know, I'm saying all that to say, I guess it depends on, even with telehealth. You know, if I'm having a telehealth meeting with my doctor and everybody in my family is in the room, that is a different experience than me meeting with him in his office or her office. So it has a lot to do with the environment that the person is in, and whether they can actually be in an environment where they can focus on what's going on the screen.
You're absolutely right. We have to be sensitive to the fact, particularly when working with children, that they may be living in chaotic environments. And not only that, they're responding to those environments at the time of the intervention. So mom and dad are there, and mom and dad may be the perpetrator of abuse. And they're relating to just their presence while trying to receive therapy. And so I agree with you that we have to factor in where the student or the client is. And it's hard to assess that through that cam. It's really hard to gauge the influence and how that may be promoting learning or distracting learning. Do you think students do better in the classroom or virtually? What are your thoughts on that?
Well, speaking of higher ed and adults, I think that it's everybody has a different learning style. Everybody has different learning styles. So there are some people who to this day will refuse to take a virtual online class because they feel like they need to have that interaction. And with that, many colleges have hybrid courses. So half of the courses are online and half of the courses you can meet the instructor at in a classroom environment. So I think everybody respects the fact that there are some people who just need to have that face-to-face learning and instruction. In the K-12 arena, you know, there are lots of factors. I think the children are not accustomed to being at home and not around their friends and seeing their teacher, being able to go outside during recess with their other students. So I think it really has much more of an impact in the K-12 environment than in higher ed. Once again, my daughter was telling me that the school that she's at has already set up an environment. It started out for special ed kids or who needed to be in that environment more than others. But now it's actually open to any parent or student who feels that they need to at least be around other students. Surprisingly, she said, though, is that not many parents are taking them up on that. Parents are not, I don't think, for the most part, ready to send their children back to the classroom.
Interesting. I was participating in a webinar with some other mental health professionals, and it was sponsored by Montgomery County Schools, and the goal was to help, to learn more from the parent perspective, the stress related to homeschooling and virtual learning and having your child fully engaged throughout the ordered day. And one of the messages that came through clearly is the parent and the student generally had to sit at the same table. I mean, they actually had to, because it was the parent that was kind of prompting them and directing them and keeping them invested. When the student was at another part of the house or the home, they were easily distracted, often off task, and it was difficult to pull them into consistent instruction. And so there is a lot of distraction in certain circumstances that prevent learning. The schools are closed and everyone's trying to get back to a new normal. Do you believe the school system should open up and attempt to encourage classroom activity?
Yeah, I think so. I'm fully vaccinated, so I'm excited about that. And I think that's going to have an impact on people being able to get back into their normal, somewhat normal environments. But I do think it's important because I respect the fact that, you know, there are different learning styles, and our K through 12 students need that interaction. I think there are many who with the appropriate resources could excel and not go back into the classroom. But I think for the most part, it's a good thing for our students to get back into the classroom. Now, the issue, though, once again, is whether teachers are feeling comfortable enough to go back into the classroom. I have to respect that. If I were a teacher, I think I might be concerned about being in a classroom full of students at this point in time.
You know, I'm an old school therapist, so when we had to convert into a telehealth model, I was very resistant. There was there was a learning curve I had to undergo. And I couldn't imagine relating to my patients through this video screen, but there was safety in doing that, so I'm on board. But now I'm considering what is it going to look like for me and my level of comfort going back into the clinic, providing one-on-one and particularly group therapy. I'm sitting in a group room with maybe 10 consumers. And although they may be safe and confident and not necessarily impacted by the experience we're just coming out of, I am the therapist. And so I appreciate how the trainers and teachers and professors will possibly present with some level of anxiety upon the return. And I wonder how that's going to translate and how that's going to play out actually in the class. What do you think are the possibilities of how the trainers, professors, teachers will now relate to students in this new?
Yeah, that's a good question. I mean, of course, you know, there are plenty of CDC guidelines that the schools and organizations have to adhere to that promote safety for the teachers. I think, you know, I hear arguments on both sides. I hear some students, some teachers saying, I just cannot wait to get back into the classroom and see my students. I miss them so much. I just want to get back, and I'd be happy to. One of the things that our president says is that the only thing that we can count on is that things are not going to stay the same as they are right this minute. Everyone is not going to be at home teleworking. But in addition to that, when you get back, it's truly still not going to be the same as it was before. And I really believe that. I think that, you know, there are going to have to be some accommodations made.
Mhm.
Or teachers will be happier with smaller classrooms, which will probably benefit our students anyway. But it's just going to be a new normal, as they say, that we're going to have to become accustomed to.
I have a son in his first year of college, and he's not a very focused student. He needs a lot of encouragement and needs a lot of reminders. But when he was forced to go to virtual learning, it really impacted his focus, and his grades went down a little bit. And he actually has become less confident with his ability to learn and master the material. And so during the season, I've seen him withdraw a little bit. And again, I'm interested to see how that's going to play out for him as we return back to classroom. Is the loss of confidence going to follow him back into the classroom, and he may not be able to perform as well? So I'll be paying attention to that as a father.
Right. Well, I think our kids are more resilient than we give them credit for. So I heard a report on the news, I think it was just yesterday, that they were saying that, there are going to be so many children who have just kind of lost a whole year of education and training. And, I maybe, but I do think that once again, our children are resilient. I think once they're much more resilient than we are.
Yeah.
Once they get back into the swing of things with school, I think they'll catch up. I just have no doubt that, it's been a crazy year. I've seen other students, college students, who have, kind of withdrawn and not been able to pull it all together when they thought they were going to be away at college with, with their friends, and all of that just came to a halt. I totally believe the resiliency in our children will win.
Yeah. The cost of tuition is constantly increasing. And I'm wondering if the students are getting the same value for their buck now that they're learning virtually. Are they receiving the same level of instruction? Should the tuition be reduced now that they're learning from home?
That's an excellent question. And without naming names, I have seen students take courses at, very expensive colleges and some at community colleges, and comparing them. Once again, it all falls back on the faculty member. If the instructor was a good instructor in the classroom, in face-to-face classroom, that fell over into their virtual environment, and they did an excellent job. If the teacher was not the greatest teacher anyway, that came out in a virtual environment. My concern is that, I'm just hoping that colleges and universities are not using this as an opportunity to, hire anyone that they think. Not all professors who taught face-to-face can teach in a virtual environment. You just can't pick one up and throw them in the virtual environment and think it's going to be successful. That is not the case. I've seen evidence of that.
Okay.
There's a lot of instruction and professional development that has to come into play to take a teacher who's been teaching face-to-face and have them teach in a virtual environment. You just can't pick one up and drop it in the other.
Well, the professors may need some additional training and support on how to use technology to deliver All
right, most definitely. I mean, I've seen teachers who taught in the face-to-face environment come to teach in the virtual environment, and they think all they have to do is just throw some assignments up and have you do those assignments and grade them. There's no interaction with the instructor. There's no discussion topics that can be addressed. So it's all about, the level of experience and training that the professor has to make the course successful.
Well, one of the disadvantages, I think, from virtual learning or working remotely is it's hard to appreciate the personality of the facilitator. Sometimes that kind of gets lost through technology, the vibe that you get, the passion, can you speak to that? Oh, we're on pause. Dr. Pailen, would you describe the workload and assignments that are given virtually versus in class to be equivalent? Or is there a difference in just the workload in the assignments?
That's a good question because for a long time, when we were ramping up our virtual environment with faculty, a lot of instructors thought that it was going to be easy street teaching online. But I think over time, and even this has been my experience, is that I think teaching online is for the workload for the instructor seems to be more. Students tend to think that you're available 24/7. I've had students who were, in other time zones who would ask questions and expect an answer at, 3 o'clock in the morning. So I think the workload is not, it's spread out over time more than it is if you go into a classroom, you teach from, 9 to 3 and then it's over. I think in the virtual environment, things get spread out a little bit more, and the workload for the instructor seems to be increased. On the student side, though, once again, it depends on how the course is structured. I think that I think that there's an opportunity for the teacher to put more information online for the student to read or to watch. And it's up to the student to spend that time on it. But I think as far as assignments, in the K-12 arena, there are standards that teachers have to teach by. So I would think that the amount of work pretty much stays the same. It's just that there's an opportunity to put more information out there for the students to help them with their studies.
Is it required that the students keep their videos on at all times?
That's a good question. I don't think, well, in the higher ed environment, that's not a requirement. And in higher ed, where I teach, a lot of the courses are asynchronous. So we're rarely online like this, speaking to each other. It's more of an asynchronous environment where an assignment is given and you can go off and do the assignment and submit it. However, if the teacher has office hours, you might be face-to-face, but so the video requirement is different there. But in the K-12 arena, I've heard different stories. I've heard some teachers want the students to have their videos on. And I understand. So, but a lot of the kids have their videos on, but all you can see is from here up, to the ceiling. So I've seen that a lot. So, it depends on the teacher, and I'm sure it depends on the subject. But as I mentioned earlier, if the video is off, and the sound is off, sometimes you really don't have a good clue as a teacher as to the level of attention that the student is paying and what's going on in their lives and in their environments. I mean, I mentioned some of her students are watching their younger siblings while they're in. So if I were teaching at that level, I think I would require video just to make sure that the student is there and listening.
What about instances of plagiarism and cheating? Has that increased during the virtual learning era, do you think?
That's a good question. Actually, we actually had a full 2-hour session discussing whether the virtual environment increased cheating and plagiarism and things like that. And I think to answer your question, I think the bottom line was that it has not increased it significantly in any way. But there are lots of opportunities for it. There are many opportunities for it. Like you said, you don't even know if the student is online. So if you're not requiring them to have their video on, so you don't even know if they're listening. There are opportunities for someone else to take tests for them and things like that. Now, there are some tools and technologies. Actually, my grandson is in college and he's doing a course virtually, and the instructor introduced, and I can't remember the name of the technology, but it had a camera that track of his eye movement, his head movement,
Interesting.
track of who else might be in the room. And that's a good tool for making sure that the person who's supposed to take the test is taking it. However, that's a huge invasion of privacy.
Sure is.
Like I said, it actually made sure no one else was in the room, and it also took control of his computer so that he couldn't use his browser to go Google an answer. So on one side, I don't think there's a significant increase in plagiarism and cheating, but there are lots of tools and technologies out there that are beneficial for that, but they also have some very invasion of privacy issues.
In a therapy context or a clinical environment, there's a lot of attention given nonverbal behavior, and you often will give individualized feedback based on what you see. And I'm wondering if the instructors are able to do the same when they notice maybe a student is struggling or frustrated or not fully engaged. I'm thinking that some of that might be lost if obviously you don't have the camera on. But even so, it's only a facial, or it may not even be that, depending on how they have the camera staged. And so that may be a disadvantage to the instructor, that they can't really gauge amenability, responsivity, all of those things that they do so naturally in a classroom. Would you agree with that?
I would totally agree with that. I totally agree with that. And once again, that's why I was mentioning earlier that if I had that type of class, I think I would need to have the video on, because you have to, as a teacher, be able to pick up on those cues and know whether the student is understanding what you're saying, or even listening for that matter. So I totally agree with what you're saying.
What advice would you give parents who are assisting their K through 12 children with distance learning?
Well, it's pretty much the advice I would give any parent is that I think that they really have to be engaged with what their students are doing. There are so many tools and technologies out there now that help parents keep up to date as to what's going on with their students. I mean, I hear stories about parents blaming the teachers for not telling them that their child didn't submit assignment 2 and assignment 4, when they had the tools right there that they could sign on to the learning management system the school is using and see that. So if they're not willing to get engaged in it, then we'll never, they'll continue to blame students and the teachers. But there are lots of ways that a parent right now can keep track of what engagement the student has in their class and their assignments.
And for some, that may actually also be a barrier. It really speaks to, does the parent have some mastery of technology, and can they engage at that level, and what is their experience working with the computer? And so depending on the parent's ability, that might drive how successful the student will be. I hear from the parents all the time, and I talk about the clients who are parents, their frustration with the demand that's been imposed on them to instruct. In fact, I hear many of people saying, well, I feel like I'm the teacher. I feel like I'm the instructor, and I have to be there all of the time throughout the day to ensure that my daughter or son is relating to the material. And for those working parents, well, those arguments. How can I satisfy that expectation that my child stays in the learning posture if I have to work and have all these other obligations? There's a lot of demand placed on parents during the season of pandemic. And as a result, they're expressing their anxiety, their frustration, their depression. Are you hearing that from parents? Is there open dialogue with some of the universities or schools, rather, really trying to listen to the complaints and concerns that parents are lodging?
Yeah, and I feel for them. Our society has allowed children to go to school and stay there all day, and the teachers are the ones who had to teach and deal with the child all day. So I can imagine, I don't have any small children now, but I can imagine what it'd be like if I had that burden just kind of thrust upon me. And like you said, some of the parents, there are a few issues. Some of the parents are not technically savvy enough to, to jump in and figure out how to look online to see what their student is doing. The other thing is there's some subjects that the parents don't even know, couldn't even help the child with. So it's, there's that difficulty there. So I totally sympathize with the parents that have to do that. But, on the other side, I'm a technology person, and I really am, once again, I'm glad that people are being thrust into this position of understanding how they need to learn some things in order to function in our society the way it is today. And, they're finding out how much they don't know. How much they know they didn't know. So
right.
I'm glad that that's happening in a way.
Yeah, we experienced a very informational podcast several shows ago. We were focusing on senior citizens, and I was made aware, and I was impressed by our guest, the boldness with which she shared the information. I was made aware of how many school-aged children are being parented by their grandparents, not their parents. And as you described, the interface with technology, how comfortable are they? Their learning style and how things were presented were very different when they were in elementary school. So how do they translate that and engage in this new learning environment? And we agreed during that podcast that the students and young folks are sometimes at a disadvantage when there's such age difference and such difference in the learning experience. So you're absolutely right. Now, what about mental health? Those children and I guess college students who might present or have a history or are predisposed to mental health dilemmas such as anxiety, such as depression, what accommodations are given them if symptomology begins to materialize? How sensitive is the school systems to relating now to mental health that's influenced by this pandemic?
Yeah, from what I've seen, both at my school at UMGC and in some of the high schools and colleges that my family are involved in, I think all of them are taking it very seriously. There's constant emails from the health departments in the various schools about COVID support. These schools are very, very, I'm not going to say lenient is not the word, but very cognizant of the fact that students may fall behind or miss assignments if there are COVID issues or pandemic issues involved in their homes or with themselves. So it's my sense, and I'm not a mental health professional at all, but it is my sense, just from the communications that I've received over the last year and a few months, about how it seems like everyone is very, very much concerned with providing financial support, for providing healthcare support, providing information. All of those things have come across my email box. We needed them, but I see them and know that these organizations are taking the mental health issues very seriously.
When you were a student, would you have preferred in-classroom learning or virtual learning?
Well, I did all of my degrees virtually. So I had some hybrid courses that I went to in the early days before they really went all virtual. So some were hybrid, but for the most part, I've done most of my education online. And, I can't remember the last time I've been to a library. I don't know when I've been to a library. I mean, I did my whole dissertation without going to the library. So that, says that, all of the tools and technologies and resources that you need in order to get an education and to get training in some areas is really available online. It all depends on you applying yourself.
Yeah.
Same thing. It's there, but if you can't apply yourself and make it and persevere and make it a commitment that you're going to do it this way, then you'll have problems.
There's definitely some advantages of virtual learning. Could you list a couple of more for us, please?
Well, of course, the biggest one, and this goes with people working from home also. I mean, it's convenience. It's very convenient for it. I was an adult learner. I didn't come out of high school and go straight into college. I was a lifelong adult learner with a child, so it was very convenient for me. And I was able to develop my career while I was doing my education. So, from the standpoint of multitasking your way up the ladder, virtual learning was very, very, very useful.
When is the last time you've been in the library? Give us a date and a month. And really, I haven't been in the library in decades, I don't think.
Right. I can't.
Yeah.
Well, no, I haven't. I had a bunch of books. I recently moved, so I had a lot of books that I was giving away. So that's when I visited the library, when I was donating books to them. So, but I haven't, if there's any reference materials or resources that I need, it's all online.
Can you itemize some of the disadvantages of virtual learning?
Yeah, well, the disadvantages go back to what we were discussing a little bit earlier. There are people who just need to be in a face-to-face environment. They feel that that's their learning style.
Mm-hmm.
And a big disadvantage, I would say, is that if you're taking courses that require some real hands-on things, like in my area, in the area of cybersecurity, we're always teaching things about networking and how to set up a virtual environment in a network and how to troubleshoot networks. That's very, very hands-on. So some of the struggles that we have is creating those labs so that these students get those. It's not like we can take them into a computer room and show them how to plug the cables and things like that. We have to teach that online. And I'd say that's been a struggle for many, many years. We're there in some areas, but virtual labs are still, that was actually my dissertation topic. The difficulty of implementing them is still not quite there. So, and I think that extends to other careers and things where you have to have some hands-on experience. That's where the disadvantages come. I mean, wasn't it? There are nursing programs now that are virtual. So they figured out a way to allow nurses, people who are studying nursing to, get that hands-on experience that they need to be a real nurse.
I cautiously wonder, how would the pandemic have affected our students if we had not been so technology advanced?
That's a great question, because I actually was just talking about that with someone, saying that if this pandemic had happened in the 80s, we would really be in trouble. But that we are as far along as we are now with online learning and labs and the ability to communicate and people to have, broadband in their homes and able to do that. I understand not everybody does, but we would have been in worse trouble if we weren't as technologically advanced as we are now. That's a great point.
Some learning would have to be on pause, because I'm not sure if we could have accommodated it. You mentioned earlier one of the advantages of virtual learning is just convenience, and I know that to be true. In the mental health clinics, we're finding an increase in compliance, scheduled appointments, because of the convenience and the privacy. You don't have to kind of duck and shun when you're trying to get in the front door to go into your appointment. So the compliance rates have increased tremendously. And I imagine, as a result of how user-friendly the platform has been for some of the clients, they may resist going back to coming into the office. It's going to be interesting to see how we transition back to a new normal, but one that has elements of the former state of being the former arrangement. I'm certain some of my clients are not going to want to schedule an appointment and come back into the office. And I'm sure that's going to be true for students. Some students are going to probably commit to this learning style and learning arrangement. What are your thoughts on that?
Well, I once again, I think it's gonna depend. Just kind of going back to the telehealth thing. I had to get a procedure yesterday, a stress test. Well, I can't do that virtually, so I had to go to the office. But I when I got out, I had some questions. I want to talk to my primary care doctor about it. I was like, oh, this is so nice. I don't have to go in to see him. I could just do a telehealth. He can pull up my records, see what happened with the test, and we can chat about it. And that's very, very convenient. From an education standpoint, I do think that there might be students who won't go back. And we talked about some of the parents who are not engaged. There are some parents who have become very engaged, who are now probably thinking about homeschooling their kids.
Yeah.
So there is the flip side to that, what we were saying, that there may be some students who are excelling in this area. There may be some parents who have figured out that they can homeschool their child and once the pandemic is over, get their children involved in social activities so that they can still have the social aspects of school. So, I'm pretty sure that there are some people who may have found this as a blessing and an opportunity to think about a new way of teaching their children. Not all parents are disengaged. Many of them are very much engaged.
Yes, I appreciate that. And we want to give them credit and acknowledge them for their commitment to their students' growth and just their learning. Dr. Pailen, do you think students should be required and/or teachers, professors, be required to take the vaccine?
Yes.
And why is that?
Well, my personal story is that I stayed away from wanting the vaccine for a while to see how things turned out. But, after several million people got it, I figured that it was probably okay. And most of the people in my sphere had received the vaccine. So I went ahead and got it also. So I do think I think it's important that people get the vaccine. That they do. And I'm pretty sure that any teacher that I know would not want to go back into the classroom without it and without the students having it also.
Would be disallowed from coming back without receiving the vaccine?
You said they would not be allowed?
Yeah. Do you think they should be banned from returning to the classroom if they decline the vaccine?
No, I don't think we should ban students. I mean, there's so many aspects of how we're going to deal with people who are vaccinated and who are not. There was some conversation about, having a vaccine passport and how important is that going to be to travel. I think all of that stuff is ludicrous because a vaccine passport is probably as easy to get as a doctor's note. You can get a doctor's note from anywhere. I'm sure there'll be a black market for vaccine cards. So I think that's a waste of time trying to make sure that everybody has that. But, I think if I were a teacher, I would want the students to be vaccinated. Now, pre-COVID, there were students who didn't want to be vaccinated for religious reasons or other reasons. And I'm not sure, are they allowed in the classroom?
I don't know. Good question.
We'd have to go by those guidelines.
Yeah, absolutely. There's some things that just can't be accomplished through virtual learning, I'm sure. For example, a couple of days ago, I had my yearly eye exam, and I had to go in. I mean, they couldn't examine my eyes remotely. I had to go in and go through the routine. I must say I was a bit nervous, but they were very careful with the distancing and disinfecting things before and after every patient. It only allowed a certain number of customers in the store at one time. But yet the only way for me to have the examination, I had to go into the office. What things absolutely cannot be conveyed through instruction by way of virtual learning?
Yeah, like I said, the only thing that I could really think of, if, things that you really have to have your hands on. There are several, professions that you would not want that practitioner to work on you if they've never had hands-on experience doing what you want them to do. So, whatever that might be, there's just a lot. And like I said, in my arena with cybersecurity and IT, just getting students to be able to have that hands-on experience with, taking care of computer equipment and networking issues and things like that. It's kind of hard to simulate that. And we're also finding too that, when these students graduate and they have not had those hands-on experiences, it's a hindrance for them to get a job.
Yeah.
We have a lot of discussions about students getting their academic degrees or getting industry certifications. And some students can come out and take an exam and say that they are a certified network administrator, and they've never had hands-on experience in that network. So when they try to get a job and they don't show any background in having done that in real life, they have difficulties getting those jobs. So employers are looking for people who've had hands-on experience.
Yes, certainly. I don't know about you, Dr. Pailen, but I'm in front of this computer all day long. I'm in this chair literally 8 or 9 hours a day. Is the same true for you?
Yes, it is. And some days, close to like today, it's, when you've been online all day long. I mean, I am actually enjoying the whole process of Zooming with people and being able to see them. That's very important. I really enjoy that. But after doing it all day long, it can get to you. We are, if I have time, we are hosting a camp for K through high school teachers in July. Okay. And we did it face-to-face a couple of years ago, but this year it's going to be virtual. And it's going to be from 8:30 to 3:30 every day for a week. And I feel sorry for the teachers in a way.
Me too.
That's a lot to be online. But, we don't have many other choices. We obviously are going to do as much as we can to keep it engaging, provide appropriate breaks, do breakout rooms for smaller groups. So there are lots of things that you can do to make it a little bit more bearable. And then we're going to do all we can to make it that way.
One of my coping strategies, well, I'll say it this way, I've never experienced my neighborhood as I have over the last 6 months. I know every house. I know how they maintain their lawn. I know what time the mailman comes, because I do strategically take walks during the course of the day. That's my only opportunity to disengage from the computer, get a little fresh air, maybe get a little snack. But yes, I'm very familiar with my neighborhood now, and I guess I'm better for it. Dr. Pailen, this has been a wonderful discussion, and we appreciate your service and the expertise you've shared with us. I'm certain that people in the audience may want to follow up with you and have some additional dialogue. What's the best way to reach you? Is there a contact number or website people can contact you?
Sure. I can give you my email address. If you have questions related to education or academic endeavors, you can just reach me at my loyce.pailen@umgc.edu address.
Okay.
That's probably the best way to reach me.
Very good. Dr. Loyce Pailen, thank you again for joining us. And I want to remind the listening audience that this is a sponsored podcast between Department of Behavioral Health and Prestige Community Resources. And if you want to learn more about Prestige Community Resources, you can go to our website, prestigecommunityresources.org, where you'll not only find a listing of podcasts, the series, but there's other information about the services we provide. Dr. Pailen, thank you again. And as I say in closing each show, be well, be safe, be blessed.
Thank you very much. I appreciate it.